My name is Laurence Albiges. I'm a medical oncologist. I'm focused on GU malignancies. I work at the Gustave Roussy Institute in France, Villejuif. I think EMUC18 is once again a place of multidisciplinarity. So as medical oncologists, I think one of the highlights is the overview that was provided by Laurence Colette on how we should think on how we develop trials and drug development in GU malignancies. And it is important as medical oncologists to think about innovative design so that we have efficient trials, meaning that are able to ask and address a rapidly evolving field in terms of new agents coming in, but also standard of care that are promptly evolving. And with this regard, multi-arm, multi-step design, such as the STAMPEDE trial, is actually able to address promptly different questions and therefore be efficient in how fast we are able to change our standard of care for our patients. So there has been several trials that have reported during 2018 that are potential practice-changing trials. Among them, we can start with the POUT trial, reported by UK team again, which highlighted the role of adjuvant chemotherapy in upper tract urothelial malignancies. I think this is important because it's a rare entity that was not easy to enroll in a trial, and now we know that adjuvant treatment with platinum-based chemotherapy should be a new standard. There are, of course, open questions such as, should we consider this approach as a neoadjuvant or adjuvant? This is something that needs to be addressed, but still, it is a game-changing trial. In the field of prostate cancer, there are at least two settings where we had new data that were presented during EMUC 2018 by the key principal investigator that conducted the study. First is the PROSPER and SPARTAN studies in the non-metastatic castration-resistant setting. Karim Fizazi highlighted those studies and presented how, with using in the non-metastatic setting but in castration-resistant patients, new agents such as enzalutamide may be practice-changing because we do have an incremental benefit in terms of time to metastasis, time to PSA recurrence. However, in this rare setting, we don't see yet the overall survival benefit because it does take time to reach this endpoint in this specific setting. Another situation in prostate cancer is the hormone-naive prostate setting, metastatic prostate cancer setting, Here, STAMPEDE data and LATITUDE data provided insight on the role of abiraterone plus prednisone on top of ADT. And what was one of the key things that has been discussed and debated here during EMUC 2018 is, shall we offer this strategy to any patient, meaning irrespective of the volume, high volume, low volume, high risk, low risk, depending on STAMPEDE criteria or LATITUDE criteria. And the work that has been conducted within the STAMPEDE dataset actually provides us insight on the potential role of abiraterone plus prednisone on top of ADT across all those different subgroups. EMUC 2018 highlighted at least the change in systemic therapy, and we will also discuss the change in the role of cytoreductive nephrectomy. But with regard to MED-ONC point of view, what is important is to see that we have new standard of care in first line with doublet immune checkpoint inhibitor, namely nivolumab plus ipilimumab in intermediate and poor risk patients, according to IMDC, which account for about 60 to 80% of our patients. This strategy is within the guidelines, both EAU and ESMO guidelines, but not yet approved by EMA authorities. And what has been discussed during this EMUC is the coming new wave of combination trials, for which we'll have the results before EMUC 2019, which are a combination of VEGF-RTKI plus immune checkpoint in first-line setting.